We're going to talk about splitting suture. So usually when you have a dissolvable suture, it gets resorbed by the body. Occasionally, for some reasons or another, the suture goes up into the epidermis and gets eliminated out of the skin. Clinically, that'll look like a nodule with a central plug of debris. So histologically, you'll see these multinucleated giant cells because it's reacting to that foreign material. And this corresponds clinically to the plug, this area of hyperkeratosis with neutrophils. You have associated chronic inflammation and histiocytic and giant cell reaction in the papillary dermis. So looking at the plug, you can see lots of neutrophils, which can be seen as a distractor because you might think, oh, is this infection? Is this psoriasis? But if you look closer, you can see these foreign bodies that correspond to suture material. Just of note, if you're not too careful, because of the inflammation, it may cytologically mimic HSV with this kind of, you might think this is margination and multinucleation. But given this is when your clinical history is helpful, and you'll see a nodule with a central plug, as well as the nucleated giant cells in the dermis, and as well as a recent surgery history will be very helpful. And if you're unsure, you can polarize it, and this will be polarizable.